I'm Jan Barker. I'm from Albany, Missouri. I had worked for the government for 25 and a half years and retired and decided to go back to school to get my nursing degree. And during finals week in 2009, I experienced the Bell's palsy. I didn't realize it at the time. They scheduled a CAT scan of the brain and found out it was not a stroke. It took about 6 to 8 weeks for it to resolve. And the only residual I had from it then was a drooping brow. I didn't have the lesion until about a year ago. And then I started noticing one on my nose. And so I thought maybe I better have it looked at. We have a family friend that is Dr. Gossett, and I just went to him thinking he could just go ahead and remove it, not knowing that it was cancerous. And he took a look at not only the brow, but he took a look at my nose and said he would prefer that I go over to see Dr. Hagan.
But because of its unique location at the tip of the nose, I really felt as if she needed a lot of preoperative support and preparation.
I just about panicked at that time. I didn't expect it to be as involved as what it was.
These are reconstructive challenges because the tissue just doesn't have enough compliance or stretchability.
So this was life-changing to me. The basal cell was down to the cartilage, and so he had to do a lot more work to take it out, as well as be able to have skin there to cover it. He'll have to go ahead and do, like, go behind the ear or someplace else for other skin.
This is not an easy operation, but we will see you through it.
He was able to incorporate the brow lift with the scarring, and it went into the natural arch of the eye. So there's not much scarring.
Jan basically had an opportunity to do a reconstructive procedure that would enhance two problems in one surgical procedure.
Dr. Hagan is a very caring doctor.
Mosaic Life Care, we've worked hard to develop a personal touch.
When I went in for my procedure, he took me into the operating room. He pushed the card in, and I've never had that done before. And then he called me the next day to see how I was getting along, and I've never had a surgeon call before.
One of my mottos as a plastic surgeon is give your personal best. I came from a family with many mothers and aunts who were nurses, and they taught me the value of giving a helping hand to those around you.
Early detection is the answer, so don't be afraid to go in. I live my life well through my faith.